Good day, I am Rico Gatchalian from 3rd year Block 2 and I'll be providing tracheostomy care. First, I want you to know that the equipment used in this video are improvised. The procedure of tracheostomy care keeps the trach tube clean, prevents clogged tube, and decreases risk for infection. The purposes are to maintain airway patency by removing mucus and encrusted secretions, to maintain cleanliness and prevent infection at the tracheostomy site, and also to facilitate healing and prevent skin excoriation around the tracheostomy incision. First, as soon as you enter the room, you have to assess the patient. Assess the respiratory status including ease of breathing, rate, rhythm, depth, and lung sounds. This is to observe for signs and symptoms of complication. Measure the pulse rate. This is to know if client receives enough amount of oxygen. Assess for the character and amount of secretions from the tracheostomy site, presence of drainage on the tracheostomy dressing or ties, and the appearance of the incision. This determines the need for suctioning and airway care management. Next is we assemble all the equipment including the sterile tracheostomy kit, towel or drape, and sterile suction tubing, sterile suction catheter kit, sterile normal saline and hydrogen peroxide, sterile gloves, clean gloves. You can have moisture-proof bag, and the commercially prepared tracheostomy dressing, cotton fill ties will be on the tracheostomy kit, and we have clean scissors. Introduce yourself and verify the client's identity. Explain to the client what you are going to do and why it is necessary and how the client can cooperate. Provide for means of communication such as eye blinking or raising a finger to indicate pain or distress. Checking identification ensures client safety through concept of correct procedure for correct client, and explanations can reduce anxiety and encourage cooperation with the procedure. Perform hand hygiene and observe other appropriate infection control procedures. Hand washing and gloving reduces transmission of microorganisms. Provide the client privacy. Ensuring privacy can promote more effective communication with the client and such to prevent embarrassment and enhance autonomy. Prepare the client and the equipment. Assist the client to a semi-Fowler's or Fowler's position. This is to help prevent aspiration of secretions as gravity facilitates drainage of secretions. Open the tracheostomy kit or sterile basins. Pour hydrogen peroxide and sterile normal saline into separate containers. Preparing equipment allows for smooth organized performance of tracheostomy care. Then establish a sterile feed. This is to prevent contamination and maintain sterility. Open other sterile supplies as needed including sterile applicators, suction kit, and tracheostomy dressing. This prepares catheter, maintains asepsis, and reduces transmission of microorganisms. In this case, I have put on my glove first so that I can organize the tracheostomy kit. Gloving reduces transmission of microorganisms, prevention of risk of infection, and maintains sterility of the suction catheter. Before suctioning, you have to organize the equipment inside the tracheostomy kit, for your hands are still sterile. Inside the tracheostomy kit, we have the tracheostomy dressing, gauze pad 4x4, pipe cleaners, pipe brush, cotton applicators, and twill ties. We also have the containers. Now we have to put the solutions in the containers. This will make my non-dominant hand not sterile. We put hydrogen peroxide on the first container of the tracheostomy kit to loosen the secretions of the inner cannula. The second container will be having normal saline solution for rinsing, and the third container will have also the normal saline solution for cleaning the incision site and the flange. Suction the full length of the tracheostomy tube to remove secretions and ensure a patent airway. This is to ensure an effective ventilation for the client. Rinse the suction catheter and wrap the catheter around your hand and peel the glove also that it turns inside out over the catheter. This clears the catheter of secretions and avoids introducing pathogen into the airway. Wrapping the catheter in glove prevents secretions from being spilled from the catheter. Using the gloved hand, unlock the inner cannula and remove it by gently pulling it out toward you in line with its curvature. Place the inner cannula in the normal saline solution. This process moistens and loosens secretions from inner cannula. Remove the soiled tracheostomy dressing. Place the soiled dressing in your gloved hand and peel the glove so that it turns inside out over the dressing. A soiled dressing is a good medium for bacterial growth and replacing should reduce risk of infection. This is also to contain the secretions inside the glove and reduce transfer of microorganisms. We put on again the sterile gloves and keep your dominant hand sterile during the procedure. This reduces transmission of microorganisms and protects the healthcare provider. Now we will clean the inner cannula. Remove the inner cannula from the soaking solution. The solution facilitates removal of mucous secretions and helps prevent infection. Clean the lumen and entire inner cannula thoroughly using the brush or pipe cleaners, moistened with sterile normal saline. Inspect the cannula for cleanliness by holding it at eye level and looking through it into the light. Mechanical force and friction are needed to remove thick or dried secretions. Rinse the inner cannula thoroughly in the sterile normal saline. Rinsing and agitation removes secretions and water from cannula. It also provides lubrication for easy reinsertion. After rinsing, gently tap the cannula against the inside edge of the sterile saline container. Use a pipe cleaner, fold it in half to dry only the inside of the cannula. Do not dry the outside. This removes excess liquid from the cannula and prevents possible aspiration by the client, while leaving a film of moisture on the outer surface to lubricate the cannula for reinsertion. Replace the inner cannula and secure it in place. Insert the inner cannula by grasping the outer flange and inserting the cannula in the direction of its curvature. This prevents trauma to the tracheal stoma. Lock the cannula in place by turning the lock into position to secure the flange of the inner cannula to the outer cannula. Oxygen is re-established to a secured inner cannula. Using sterile applicators or gauze dressings moistened with normal saline, clean the incision site. Handle the sterile supplies with your dominant hand. Use each applicator or gauze dressing only once, then discard. This avoids contaminating a clean area with a soiled gauze, dressing, or applicator. Hydrogen peroxide may be used to remove crusty secretions. Check the agency policy. Thoroughly rinse the cleaned area using gauze squares moistened with sterile normal saline. Hydrogen peroxide can be irritating to the skin and inhibit healing if not thoroughly removed. Clean the flange of the tube in the same manner. Dried secretions are a good medium for bacterial growth. Thoroughly dry the client's skin and tube flanges with dry gauze squares. Moist surfaces support growth of microorganisms and skin excoriation. Apply a sterile dressing. Use a commercially prepared tracheostomy dressing of a non-raveling material or open and refold a 4x4 gauze dressing into a V shape. Cotton lint or gauze fibers can be aspirated by the client, potentially creating a tracheal abscess. Place the dressing under the flange of the tracheostomy tube to protect the client from secretions. And while applying the dressing, ensure that the tracheostomy tube is securely supported, because excessive movement of the tracheostomy tube irritates the trachea. Now we change the tracheostomy site. Cut a length of twill tape 2.5 times the length needed to go around the client's neck from one tube flange to the other. If the tape is too loose, the tube may move and cause bleeding and granulation, and the tube may fall out easily. Cutting one tape longer than the other allows them to be fastened at the side of the neck for easy access and to avoid the pressure of the knot on the skin and at the back of the neck. Thread one end of the tape into the slot on one side of the flange. This is to secure the tracheostomy tube in place. Securing tapes in this manner avoids days of knots which can become irritating to the patient. Bring both ends of the tape together and take them around the client's neck, keeping them flat and untwisted. This is to bring client in comfort and does not cause irritation to the skin. Have the client flex neck. Tie the loose ends with a square knot at the side of the client's neck, allowing for slack by placing 2 fingers under the ties, as with the two-strip method. Cut off long ends. Flexing the neck increases its circumference the way coughing does. Ties must be taut enough to prevent accidental dislodging of tracheostomy tube, but loose enough not to cause choking or pressure on the jugular veins. Ties at the ends of the neck are more comfortable for the client. Tape and pad the tying knot. Place a folded 4x4 gauze square under the tying knot and apply tape over the knot. This reduces skin irritation from the knot and prevents confusing the knot with client's gown ties. Check the tightness of the ties. Swelling of the neck may cause the ties to become too tight, interfering with coughing and circulation. Ties can loosen in restless clients, allowing the tracheostomy tube to extrude from the stoma. Document all relevant information. Record suctioning, tracheostomy care, and the dressing change, noting your assessments. Accurate and timely documentation and reporting promote patient safety.